Ramsay-Hunt syndrome by Julia Grable. Ramsay-Hunt syndrome is a pathology named after the physician who discovered it, Dr. James Ramsay Hunt. RHS, or Ramsay-Hunt syndrome, is a side effect of the varicella zoster virus, which is the same virus that causes shingles and chickenpox. RHS can be caused by the reactivation of a dormant virus. For example, if you had chickenpox in the past, you could get RHS. Why this happens is still unknown. RHS presents as a rash around the face, ear, and mouth, and it also presents as facial palsy. It primarily affects the facial nerve near the inner ear. 12% of peripheral nerve palsies can be attributed to RHS. Peripheral nerve palsies are a type of nerve disorder that can result from trauma, injury, nerve compression, a genetic disorder, or a disease. In this case, RHS arises from the reactivation of the virus in the facial nerve, which I'll talk about more later. To the right is an image of common symptoms associated with RHS and an image of the facial nerve and how close it is to the inner ear. So, who does RHS affect? RHS primarily affects adults over 60. However, children can still develop it, although it is rare. Women tend to get RHS more than men, and anyone who has had the virus is susceptible. To the right is a rash, an example of facial palsy, consistent with RHS. In my research, I found a lot of controversy over Bell's palsy and RHS. However, I want to make it perfectly clear that these two are not synonymous and cannot be used interchangeably. Bell's palsy is significantly associated with the herpes simplex virus, as you can see illustrated by the Venn diagram in the bottom right corner. Bell's palsy may also have a genetic factor correlated with it, and is often caused by a restriction of blood flow or compression to the facial nerve. And it doesn't usually show with a rash, whereas RHS has long-term effects generally, and the paralysis is severe on onset in most cases. Furthermore, RHS differs from normal anatomy because there's a correlation between the distribution of the varicella zoster virus with pathological changes in the ganglia in RHS. Motor fibers are affected as they pass through the geniculate ganglion, disrupting motor functions of the facial nerve. The sensation of the ear is somewhat derived from the geniculate ganglion of the facial nerve. Quote, efferent fibers exit the brainstem and travel through the internal acoustic meatus to enter the bony facial canal and exit the stylomastoid foramen to supply facial muscles. But in RHS, these fibers are affected as they pass through the geniculate ganglion, disrupting motor functions of the facial nerve, end quote. And you can see that illustrated here with the geniculate ganglion and the motor tract of the facial nerve. This is a possible presentation of Ramsay-Hunt syndrome. Symptoms include ear pain, hearing loss, vertigo, which is that dizzy, off-balance feeling, tinnitus also, unilateral facial weakness, and flu-like symptoms. Some rare symptoms include a dry mouth and irritated eyes, loss of taste. I felt like that was pretty relevant with COVID and interesting. And it's important to note that these symptoms do not need to occur simultaneously. The progression of the disease varies case to case depending on the severity of the nerve damage to the facial nerve. However, rapid treatment is key, and you have a better prognosis within treatment of 3 to 7 days. 3 weeks is the standard recovery. Complete recovery is less likely in adults. Overall, if you suspect something, say something, get medical attention, and also get the shingles vaccine, so you hopefully do not get this virus in the future. As for treatment, the ideal treatment is within the first 3 days or 72 hours of onset of symptoms, and you'll use a combination of antiviral treatments and steroids, which include topical and oral medication. You can diagnose RHS through MRIs, testing through your blood or skin samples of rash, as well as a thorough patient history. You need a very thorough clinical evaluation. Prognosis. Unfortunately, as little as 20% of those with RHS fully recover, and there is a worse prognosis for those with pre-existing health conditions such as diabetes or hypertension. Complications of RHS include permanent facial palsy, hearing loss, neuralgia, which is pain caused by irritated nerves, as well as neuropathy, which is weakness and numbness of nerves. And an interesting statistic is that 5 out of 100,000 cases per year in the United States are RHS cases. Here's a look at a quick case study. Unfortunately, in my research, no one extremely famous has ever been diagnosed with RHS, but Jen Least is a YouTube personality who focuses on spending less money. And I attached a YouTube clip for you all to watch and learn more about her journey with RHS. Overall, she described it as her nerves overreacting and suffered from hearing loss and paralysis. Another case study is about a 54-year-old Caucasian woman who experienced neck pain, a vesicular rash, which is a bumpy rash, headache, and then eventually right-sided paralysis. You can see on the image below. To the right is a description of the timeline of her RHS. And you can see by day 46, her paralysis started correcting and she started being able to smile again correctly. And her facial symmetry started returning thanks to antiviral drugs and steroids. So I want you to reflect. What did you learn? I hope that you learned that RHS is a rare peripheral nerve palsy that affects primarily the facial nerve as the varicella-zoster virus is reactivated in the geniculate ganglion. It generally presents as a rash and unilateral facial palsy. However, these do not necessarily occur simultaneously. Here are the questions. You can pause now and answer these. And here are my works cited. Thank you so much.